But let's start by talking about inpatient drug withdrawal management. I know, it's a mouthful. We're also talking about detox. Places where people can go to try to kick addictions and get help for things like withdrawal symptoms. Measure 110 decriminalized drugs and was hailed as a big change that would help a lot of people suffering from addiction by sending millions more dollars towards treatment. So, are more detox beds part of that thanks to 110? Well, that, my friends, is our big story tonight. Over the past year, our Blair Best has shadowed outreach workers as they contact people on the streets suffering from addiction. Several told her that one of the big challenges is finding space at an inpatient detox facility to help them through the brutal first step of getting sober, withdrawal. That kind of treatment is rarely, if ever, available right away in our area. In Portland, lines often form outside of two large-scale walk-in detox facilities early in the morning, with many people being turned away due to a lack of space.
I just actually walked out of the rehabilitation center after waiting and just said, I just need help. And to not be able to get that, yeah, very deflating.
It takes enough courage just to show up to those places, to these places, and then when the help isn't there, yeah, it's definitely disappointing. Oh, they just took my information and then called all the names of who they were accepting, and then whoever they didn't call, they didn't have a bed for today.
According to a March 2019 report, before Measure 110, there were 13 detox facilities licensed with the Oregon Health Authority. They had a total of 201 beds. They were located in 9 of Oregon's 36 counties. Now, there are more. OHA data that we got through a public records request shows there are now 22 licensed detox centers in Oregon with a total of 308 beds, so 107 more beds than before. Those are located in 14 counties, though some are incredibly small. In fact, 3 of them share one campus. Overall, though, it's great. There is more room. Now, some of that growth was apparently happening before Measure 110 made more money available for those services, but more is still more. Remember, nearly $300 million in state cannabis taxes were rolled out thanks to Measure 110, but there were major delays, meaning that money didn't get out the door until late last year. So, with all that money in the pipeline, we're sure to see a huge expansion in new detox beds, right? Well, kind of depends on who you ask. Our team was intrigued by a June 2022 presentation at the Jackson County Public Safety meeting. The CEO of a Southern Oregon treatment center outlined 3 things that she says are not eligible for Measure 110 funding.
Treatment services that are not eligible for funding at this time are medical detox, residential treatment, and mental health services.
None of those are explicitly mentioned as not eligible in Measure 110 documentation, but one source told us it's because they're not considered low barrier sources of treatment, and it's the low barrier sources that will get funded. So, what do the rules around Measure 110 actually say about what qualifies for grants and what does not? Well, here are the big ones. Services that are trauma-informed, have little in the way of wait times, and are provided regardless of criminal history, residency, or ability to pay. And it's here that we find a little bit of a disconnect and a problem. If one of the qualifications to get that grant money is little to no wait times, well, then it appears that the only 2 big detox facilities in the Portland area would not qualify. Those Measure 110 rules, that little wait time, that means a patient receives treatment services within 48 hours of their initial assessment. If the detox is bursting at the seams, has wait lists and lines out the door, then no, they're not going to qualify for that. They're not low barrier in that context, meaning they cannot benefit from Measure 110 funding. Now, that's a problem because it also means they may not be as likely to expand to meet the greater need in our community. A leader at one of the 2 detox centers in Portland said they thought about applying for Measure 110 funding, but then decided it just was not worth the effort.
Measure 110, the easiest funds to access were starting things new and from scratch, right? So we'd love to renovate our building, we'd love to add a bunch of beds, and we evaluated whether or not Hooper would be appropriate place to apply for a Measure 110 funding, and we decided not to. We decided that what we would get was not really worth the time and energy. And then there were other ways to kind of get our needs met in terms of funding.
Okay, well, that's kind of disheartening. But hold on, one of the 3 people overseeing Measure 110 said those detox programs do qualify for funding. Onisha Cochran seems willing to acknowledge the problem of having too little in the way of inpatient detox services, but rejected the idea that medical withdrawal management, residential treatment, and mental health services are not eligible for funding. She told us, quote, "This isn't true. We funded programs similar to this." She sees the detox deficit as a problem with many sides. First, she said it can be expensive to get an inpatient detox center started. She says the Measure 110 grants are generous compared to what was available before, but they're not enough to bankroll a brand new facility.
It's mind-boggling to think about how much inpatient treatment costs. So the reason why Measure 110 was created is like people weren't being successful with that type of model. We had to think of so when people think of $300 million, they say, well, you know, $300 million is a lot of money, but not when you're splitting it with the entire state of Oregon. Right. So what Measure 110 did is it didn't not fund treatment beds. It funded organizations that already had the infrastructure to build Medicaid, and they had treatment beds. But the very new, we had a few organizations that were like super brand new, and they had these amazing ideals to have these treatment beds, but they didn't have the infrastructure to implement the treatment beds at the rate that treatment beds are used.
The 110 grant money cannot be used for things that insurance can pay for, but Cochran says there's still plenty of ways it can be used to fortify what's already available.
And I appreciate people saying we still need treatment beds, and this thing, Measure 110, did fund a lot, but we need to rethink how we're going to impact more treatment beds. And maybe the solution to that is to support the infrastructure of the treatment beds that already exist.
And that's the view on things from one of the chairs of the Measure 110 Oversight Board. But when it comes to people treating folks with addiction on a daily basis, the need is clear.
You know, there's not enough capacity for treatment in our whole state. So we need more programs that can admit our patients in a timely manner for outpatient treatment. We need more residential beds. We need a wider variety of beds that can meet the needs of people with disabilities, maybe folks with more serious mental health issues.
Even Dr. Risser admits that sometimes it may not be available, but just an available bed problem, but also, you know, kind of a staffing issue, one that's felt all across the behavioral health field right now. This detox deficit, as we're calling it, has really not popped up out of nowhere. A state has done a study after study after study showing how great the need is. In fact, they just started another study last month to review the state's residential mental health and substance use treatment capacity. OHA says the study will build on yet another study, of course, that was done last year by OHSU and PSU, looking at significant service gaps in the state's behavioral health system. Now, I know that's a lot to digest, but what's going through your mind right now? Should we focus on building more treatment beds or use Measure 110 money to reinforce current infrastructure? Let us know your thoughts, will you? Shoot us an email and maybe a glass of water for me to sip at thestory@kgw.com, or call and leave a voicemail, 503-226-5090.